Among medium September and the 1 week end March 18, more than rather than 15,370 cases of the year-old murderer were informed to Social Public Health England. More knowledge and superior accountability practices may include introduced to the growth, told nickname Finn, Vice CEO at Social Public Health England. Identified by a vivid red reckless how looks and feels love emery paper, red dengue is a very infectious illness inflicted by the identical bacteria over streptococcal neck, team A strep pyogenes. Social Public Health England is counselling parents to be on the observation for these symptoms, as if trapped previous, the disease is soft and can be purified in antibiotics. Previous treat can as well bring the chances of complications, such as pneumonitis, and hinder the distribution of contagion. We are tracking the position close and recall parents to be aware of the symptoms of red dengue and to pin their household doctor for evaluation if they believe their kid might include he, Finn told in a declaration. It is a really infectious illness and lot more than overall in family by 10 rather than younger generation or adults, told Professor Helen Stokes-Lampard, armchair of the King's School of General Practitioners in the UK. Red dengue utilized to be a lot more than overall rather than it is currently, but GPS are noticing more than cases rather than in early year at the time. Infections extended to growth to almost 20,000 in 2016, a 50-year top for the joint realm, on to the analyze. The public health agent is as well enterprising household physicians, pediatricians and some public health practitioners to be aware of the contagion while evaluating patients. Identification: red dengue. Though nobody who gets streptococcal neck can get red dengue, as well named as scarlet fever, the illness characteristically strikes family by the age of 10. Often distribution by splashes via cough and sneezing. Team A streptococcal can as well conceal on doorknobs, sheet and items for several hours. The red reckless how gives red dengue its behalf characteristically starts on the cervix and person and spreads to the trunk, the behind and some components of the flesh. At first, the reckless will see love a bad tanning, but later it will start to lift and be rough. If compressed, the red leather will rotate whites, it can as well be itching. One day the reckless subsides, the leather will frequently rind, particularly on the crotch, fingertips and tiptoe. A really ulcer, red neck how makes it hard to martin, on in a dengue of 101 or high, is a key mark of red dengue, on in swell cervix glands, headaches and flesh chills, sickness and vomit. An previous sign can be a strawberry language, one how looks more than red and rough rather than normal, on in a albescent surface on within of the neck. Some treacherous signs involve a flushed person, besides for a white strip about the jaw, and red smudges in the creases of the leather, in the underarm, knees and elbows show a more profound shade. Treat for red dengue is a year of antibiotics, that must be finished to be rid of the bacteria and escape a recurrence. If the regime is accompanied accordingly, the illness is normally lost during a pair of weeks. Leftward raw, it can conduct to severe disease or though die. Complications of red dengue can involve Vivid's illness, a shape of renal harm, and rheumatoid dengue, an autoimmunity illness how affects the cardiac, joints, leather and marrow. If rheumatoid dengue affects the cardiac, it can reason length-term harm. How's one of the reasons red dengue was a guideline reason of cardiac illness for adults up penicillium was found.